Good morning, Social Security. May I help you?
Yes, this is Sam Jones, and I have a question in reference to Medicare, or it could be Medicaid. Tell me, what's the difference between Medicare and Medicaid? I think I'm covered under one of these programs, but I'm not sure exactly which one. And my doctor tells me that maybe I'm eligible under both programs. Have I contacted the right office for assistance?
Well, Mr. Jones, here at Social Security, we are glad to answer any questions you have on Medicare. For Medicaid, you would have to contact the local Medicaid office. What is it you would like to know? I'll try and explain it to you or refer you to Medicaid.
Well, see, I just got out of the hospital.
Since the question, what's the difference between Medicare and Medicaid, is a common one asked by many people, why don't we try to determine exactly which program is which? Now, to begin with, there is some confusion about Medicare and Medicaid. First of all, the two words sound almost alike, and that suggests similarities in what they represent. But it also means there are differences in the two programs, and we'll talk about both. So let's compare the basic aspects of Medicare and Medicaid and see if we can determine which is which. To begin, let's consider the similarities. First, both programs were made part of the Social Security Act by the 1965 Social Security Amendments. Medicare enacted as Title 18 and Medicaid as Title 19. Secondly, both programs have a primary function of financing all or part of hospital costs, physician costs, and other health care costs. Next, both programs rely heavily on federal funding. Another similarity is that both are concerned with promoting a health care delivery system that is cost efficient, of high quality, and free of program misuse. And finally, federal responsibility for both programs has been assigned to the Health Care Financing Administration, an agency within the Department of Health and Human Services. This agency's primary responsibility is to coordinate the federal aspects of both Medicare and Medicaid. This includes defining beneficiary eligibility and covered services, reviewing the quality of care rendered by providers of health care, controlling the disbursement of federal funds for health care services rendered by providers, and assisting in the elimination of situations involving possible program misuse. Now, how does Medicare differ from Medicaid? Well, first, Medicare and Medicaid differ in the way they're administered. Medicare is administered totally by the federal government through contracts with various private insurance companies and state agencies. Now, because it's totally a federal program, Medicare is uniform throughout the country. Medicaid, on the other hand, operates on the basis of a state-federal partnership. Each state develops its own individual program within broad federal guidelines. The Medicaid program is then administered through its Medicaid state agency. Now, because it is state-administered, the scope of Medicaid benefits varies from state to state, but each state must provide certain required services to participate in the program. In addition to differences in administration, both Medicare and Medicaid have different eligibility requirements. Medicare covers 3 specific groups of people, regardless of their financial need. These groups include Social Security and Railroad Retirement beneficiaries 65 and older. Also, Social Security and many Railroad Retirement beneficiaries under 65 who have been entitled to disability-based benefits for more than 24 months. And most people with end-stage renal disease who require regular dialysis treatments or kidney transplant surgery regardless of age. Medicaid, on the other hand, covers certain groups of low-income people who need assistance in meeting their medical expenses as defined by the state they live in. To be eligible for Medicaid, the applicant must fall into one of 4 groups. 1, needy people 65 and older. 2, the needy blind. 3, the needy disabled. And 4, members of certain needy families with dependent children. In many states, there is an agreement between the Social Security Administration and the state in which an aged, blind, or disabled person receiving payments under the Federal Supplemental Security Income Program is automatically eligible for Medicaid. And in most states, anyone receiving cash assistance under the Aid to Families with Dependent Children, another state federal program, is automatically eligible for Medicaid. In addition, a large number of states will qualify people for Medicaid if their income and resources are too high to receive cash assistance under SSI or AFDC, but insufficient to meet medical expenses. These people are known as medically needy. So Medicaid eligibility is related to a person's financial need. Medicare eligibility is not. Another difference between Medicare and Medicaid is financing. The money for Medicare comes from specific federal trust funds. Hospital insurance under Medicare, known as Part A, is financed through payroll contributions, deductibles, and co-insurance payments. Medical insurance under Medicare, or Part B, is financed by monthly premiums paid by or for the beneficiary and by general revenues. Medicaid funding comes from federal, state, and in some cases, local taxes. On the average, by matching state funds, the federal government pays over half of the Medicaid bills. The lower the per capita income of a state, the more the federal government will pay the state toward Medicaid bills for its recipients. In Mississippi, for example, the federal government's share of that state's total Medicaid bills is about 78%. In New York and in 14 other states, the federal government pays 50%. The maximum matching rate by law is 83%. The minimum is 50%. Another difference between Medicare and Medicaid is the way in which claims are processed. Under Medicare, payments for Part A hospital care, skilled nursing facility care, and home health services are made directly to the providers of these services. However, Part B of Medicare gives physicians and other suppliers of medical services the option of receiving payment directly from Medicare, called taking assignment, or billing and collecting from the beneficiary. The beneficiary, in turn, would be reimbursed by the Medicare contractor. In Medicaid, all providers bill the state Medicaid agency directly and receive their payment from them. No payments are made to the patient or by the patient except for minimal cost sharing. Also, with Medicaid, there are no major deductibles, co-insurance payments, or monthly premiums as there are with Medicare. Another key element in this claims process is that Medicare claims are processed jointly by the federal government and private industry. Under Medicare, the federal government contracts with private insurance companies in each state for the processing of Medicare claims. The companies that process claims for hospital insurance benefits are called intermediaries, and those that process claims for medical insurance benefits are called carriers. Some companies process both Part A and Part B claims. With Medicaid, the Medicaid agency within each state has responsibility for the processing of Medicaid claims. It will either process all of its own claims or contract with another organization to process a part or all of the claims. The contractors processing Medicaid claims are called fiscal agents. Another point to remember about the payment of claims under the two programs is that certain people in many states may be eligible for both Medicare and Medicaid. If so, Medicaid supplements Medicare coverage. Medicare is the primary payer for services covered by both programs, such as inpatient hospital care and physician services. Medicaid then pays for the Medicare deductibles, coinsurance, and monthly premiums for eligible people. And finally, there are different sources of assistance with Medicare and Medicaid. For answers to questions about Medicare, the public should call or visit the nearest Social Security office. The network of Social Security field offices is responsible for establishing Medicare entitlement and for assisting the public with Medicare inquiries and problems. Also, after a claim has been filed, inquiries may be directed to the Medicare contractor, the private insurance company that handled the claim. Social Security offices can provide the names and telephone numbers of Medicare insurance companies for further information on what Medicare covers and the claims process. Information about Medicaid should be obtained from the nearest office of the state Medicaid agency. Only the Medicaid agency can answer questions about eligibility and types of health care services offered under Medicaid. Remember Mr. Jones? He called the Social Security office by mistake. His questions concerned Medicaid, and he was referred to the local Medicaid office where all his Medicaid questions were answered. Now, before closing, let's review the similarities and differences of the two programs. We've said that Medicare and Medicaid are similar in that both are part of the Social Security Act. Both help people obtain health care services which many could not afford. Both involve federal funding. Both are concerned with promoting an efficient health care delivery system of high quality and free of program misuse. And both are under the federal jurisdiction of the Health Care Financing Administration, an agency within the Department of Health and Human Services. At the same time, we've seen that there are differences between Medicare and Medicaid. Differences in administration, in eligibility requirements, in financing, in claims processing, and in places to go for information and assistance. So when you're asked, what's the difference between Medicare and Medicaid, you'll be glad to help a beneficiary distinguish between them. That is, to determine which is which.